You are born into the poorest part of a medieval town. You will never own land, and you will never sit in a university and study Latin medical texts. At 7 years old, your father puts a heavy straight razor into your hands. He tells you this one blade will have to serve three very different worlds. It will shave the beard of a nobleman. It will cut open an infected boil on a peasant's back. And sometimes, it will cut through a dying man's flesh. Medicine has a strict hierarchy here. University physicians study medical theory. They examine urine, debate ancient texts, and argue about what is happening inside the body. But when someone actually needs to be cut open, someone else does the work. Touching blood is manual labor, and manual labor is beneath a scholar's dignity, so the dirty work falls to someone who already handles a blade every day, a barber, like you. Your first childhood memory is not a lullaby. It's the sound of a grown man screaming while your father calmly sharpens his surgical saw. You might wonder how anyone could grow up normally in a place like this. How do you learn to live with pain, blood, and death before you are even old enough to understand them? The answer is simple. You don't. You just get used to them. By age 10, your childhood is over. Your days are spent sweeping the shop, boiling rags, and learning to keep a blade sharp enough to split a hair. You are taught the medical theory that shapes almost everything you do. The four humors. The theory says that four fluids in the body must remain in balance. When that balance is disturbed, illness follows. Blood, phlegm, yellow bile, and black bile. Some physicians believe that too much blood can cause illness. Fever? Bleed them. Stomach pain? Bleed them. You begin your apprenticeship alongside 3 other boys from your street. None of them make it to adulthood. One cuts his palm on a dirty blade and dies from infection a few days later. Another spends years breathing smoke and rot inside the shop, and his lungs eventually give out. The third is taken by a local lord and sent to fight. You never see him again. By 15, you are the only one of the 4 left, except for old Britius. Britius trained your father before you were born. His hands shake too badly to hold a razor now. But he still sits by the shop door, sharpening blades nobody asked him to sharpen, because it is the only work his hands still remember. One day, he tells you something he would never say in front of a university physician. Sometimes, bleeding really does seem to help. A man swollen with fluid may breathe more easily afterward. A racing heart may slow down. Britius has seen it happen too many times to call it simple luck. But for every patient who seems to recover, he has watched others grow weaker and die even faster. And he has no way to know beforehand which patient will survive. You keep this doubt to yourself. Question the 4 humors too openly, and people may dismiss you before they even listen to your reasoning. So you carry the same quiet doubt as Britius. You aren't sure bloodletting is a complete lie. But you're starting to suspect that this medical gamble is stacked against your patients. One evening, a young woman is carried into your shop. She is burning with fever. Her parents beg you to save her. You follow the rules, you use leeches, you open a vein, and let out the bad blood. By dawn, the shop has gone silent. You set down your blade, your hands are trembling. You brace yourself for a beating, because in your young mind, your blade killed her. But the violence never comes. Her parents kneel in the doorway, heads bowed, silent. Her father thanks you for trying. Then he presses 2 tarnished copper coins into your hand. You stare at the coins. Your palm still carries a faint red stain. And for the first time, you understand something about your profession. The tragedy wasn't that medieval medicine had no rules, it was that many of those rules were built on a model of the body we now know was wrong. You followed every rule correctly, and she was still dead, and they paid you anyway. At 18, war arrives. The local lord conscripts you as a military surgeon. The university physicians stay behind. You follow the army into the mud. There is no anesthesia. A wounded man is given cheap alcohol and held down by several strong men. Speed is everything. The faster you cut, the better his chance of surviving the shock. One brutal afternoon, you lose count of how many shattered legs you cut through. You work through bone with steady hands, then move quickly to stop the bleeding. Cauterization. By nightfall, only a handful of the men you treated are still breathing. Your clothes are stiff with dried blood. Your mind is completely empty. Then the commanding general walks into your tent. He walks past the rows of wounded and the still forms beyond them. He doesn't look down. He only counts the men who are still alive. Then he looks at you and says one word: adequate. Adequate. It isn't praise. It's an inventory check. The men who die are losses. The ones who survive can fight again. And suddenly you realize something. You and the dying men are not so different. You are all numbers on the Lord's ledger. And if you stop being useful, you can be replaced. You survive the war and return home. You are 28. Britius is still alive. Barely. He is the first person you look for when you walk back into the shop. For a few years, life is almost quiet. You take on your own apprentice, a boy who reminds you of yourself. You teach him to sharpen a blade the way Britius taught you. But when no university physician is listening, you teach him something else. Watch the patient before you reach for the blade. Don't bleed someone just because the rules say you should. Then the Black Death sweeps across Europe. Some wealthy physicians flee the city, others stay. You stay too, because this shop is still your only livelihood. You treat the plague sores others are too afraid to touch. You clean rotting wounds. You touch people everyone else is afraid to touch. Britius does not survive the plague year, neither does your apprentice. And somehow you do. You become one of the few people left who isn't afraid to touch the sick. The skill that once kept you at the bottom of society is suddenly impossible to replace. People begin to respect you. They still don't call you a physician. That title belongs to the men in silk robes. But quietly, people begin calling you something else. Surgeon. It isn't your official title. On the guild rolls, you are still a barber. But your hands have become valuable, and that gives you a dangerous illusion. The feeling that maybe you can actually fight death, but your entire career still rests on a gamble. You were never allowed to know the true odds. A gamble built on bloodletting and unsterilized blades. You made a living from a system you had never been allowed to question. Now, that system comes home with you. One quiet night, your wife collapses. She develops a sudden fever. A dark swelling appears on her neck. For the first time since childhood, you feel real panic. You grab your finest blades. You bring out your best leeches. You cut. You bleed her. You know better than anyone how often this fails. You know the chances are terrible, but you act anyway, because even a tiny chance feels better than doing nothing. But this time, nothing works. You do everything you know how to do. By morning, the room has gone quiet. You sit alone in your large house. By now, you are one of the most respected surgeons in the city. But there is something you finally understand. Your trade helped you treat thousands of strangers, but it could not save the person you loved most. Decades pass. Your fame fades. You are an old man now. Your hands shake too badly to hold a straight razor, so you sit by the door just as Britius once did. You sharpen blades nobody asked you to sharpen, because your hands still remember the work. One morning, a 7-year-old boy appears at your door. He wants to become your apprentice. Without saying a word, you hand him the heavy blade. The blade passes on. So do the mistakes. But not exactly as before. You have taught him to look at the patient first. Outside the shop, a painted wooden pole turns slowly in the wind. The red was traditionally said to represent blood. The white, the bandages used to stop it. And the pole may have echoed the stick patients once held during bloodletting, a visual legacy of a brutal trade. When you finally die in your sleep, the city clerk updates the registry. He records your profession like he records the city's other tradesmen. One line. Master Barber, deceased. The official ledger records the money you earned for the guild, but it never records the screams. It never records the wife you failed to save. It never records Britius, or the apprentice you buried during the plague. And it certainly never records what those years did to you. But hidden deep inside your mattress, far from anyone's eyes, lie 2 heavily tarnished copper coins. The payment for a young life you could not save. The price of the first time you realized that following the rules did not guarantee a good outcome. Nobody will ever know their story. And outside the shop, the red and white pole keeps turning in the wind, waiting for the next boy to pick up the blade. The razor never changed. What changed was what a society allowed the person holding it to become. History books are filled with kings, plagues, and grand theories. But history was also lived by ordinary people holding dirty razors in the dark. If this journey through medieval medicine made you look at the past differently, take a second to like the video and subscribe. And tell me in the comments, at what age do you think you would have broken under this system? Until next time, be thankful for the silence of modern medicine.